Now let's talk about some medicines as well. So what I've got here on the board are kind of your classic drugs that are used by doctors today to treat diabetes. And so you can see sulfonylurea drugs here, classic medications. Well, this class of medication depletes CoQ10. Why is that important? Because CoQ10 deficiency reduces the body's ability to process carbohydrate, so glucose. One of the ways we make energy effectively is we take glucose from the food that we eat and we run it through these different cellular mechanisms that convert that glucose into energy in the body, also known as ATP. Well, the rate limiting step for energy production by your body is CoQ10. And so if you think this through a little bit, you know, if you have diabetes or your doctor says you have prediabetes and now they're wanting to prescribe different medications for it, if those medications interfere with your body's ability to generate energy, how much do you think you're going to feel like exercising? How well are you going to break down glucose from the food that you eat? So what happens is people become more tired, they exercise less, that affects their blood sugar, but then they also biochemically can't break their glucose down effectively. That elevates their blood sugar. And ultimately, the drug gives you kind of a temporary transient change effect, but over time, it actually contributes to or leads to the very type of disease or outcome that your doctor's saying he's trying to prevent with you. We see the same thing happen with metformin. One of the reasons I'm not a fan of this drug, and there's a lot of doctors online right now talking about using this as an anti-aging medicine that everybody should be taking because of its anti-aging effects. But if you understand the biochemical mechanism of side effects of metformin, which is that it depletes CoQ10, vitamin B12, and folate, and here in just a minute we'll talk specifically about these micronutrients, B12 and folate, and you understand that when you inhibit these nutrients, you actually cause an increase over time in blood glucose. So not good. And then you have this newer class of medicines, the ones people are going crazy over, you know, especially this one here, this Ozempic. Everybody's talking about this one now as a weight loss aid. But look what it does. Slows down gastric emptying, so it affects how you can poop, right? The other thing that it does is it can inflame your pancreas. Now, what is the organ that controls blood sugar? It's the pancreas. The beta cells in the pancreas are responsible for making insulin. So if you're taking a medicine that causes inflammation to your pancreas, how long do you think that's going to play out before you start having an impact or an effect here? You know, with medicine, there's always a side effect. There's always a price to pay. You know, it's like you rob Peter to pay Paul. There's always going to be a later price to pay. And pancreatitis is one of the potential side effects of being on these GLP-1 receptor agonists. And then general malnutrition, because one of the side effects too for a lot of people that take this stuff is diarrhea. And that diarrhea can cause malnutrition. It can cause malabsorption, malnutrition of micronutrients. And micronutrients are a critical component to regulating blood sugar, which again, we'll talk about that here in just a second. Now, there are other medications that I want to point out. So these are just the meds. The irony here is, again, these are the medicines that doctors use to control blood sugar for people who aren't controlling their own. But there are a lot of other medications that get used very commonly. And one of the class of medicines is called diuretics. Of course, diuretics deplete B vitamins, particularly vitamin B1, but also deplete CoQ10, magnesium, and calcium, which are implicated. All of these are implicated when you don't have adequate quantities of these nutrients. They're implicated in raising or elevating your blood sugar because they impact how your body can process it. So diuretics play a major role. And again, this is a class of medicines that are commonly used. Furosemide is a diuretic. The Lasix, for those of you who are taking it, and then hydrochlorothiazide is another very commonly prescribed diuretic. So you have to be aware of these classes of medicines that can also impact your micronutrition that subsequently would cause your blood sugar to go up. But one of the other big ones is antibiotic. Antibiotics deplete your microbiome, right? So in causing a deprivation of your microbiome, so impact on your microbiome, understand that one of the things your microbiome does is it helps you to regulate sugar, helps regulate blood glucose. And one of the ways it does that is the actual bacteria that live in your GI tract, many of them help you make B vitamins. And so when you decimate your microbiome on a regular basis with repetitive use of antibiotics, you actually can deprive yourself of the very B vitamins necessary to control your blood sugar. The theory is that this is one of the reasons why farm animals get so fat so fast, is that broad use of antibiotics. As a matter of fact, a lot of farmers want to use the antibiotics to fatten their animals up quickly so that they can take them to market and sell them for more money. You know, humans aren't any different in that regard. If you're chronically using an antibiotic, you can chronically create problems again in your B vitamins. I wanted to show you this. There are a number of different studies that have been published on antibiotics. Use of antibiotics and risk of type 2 diabetes, overweight and obesity, the cardiovascular risk in young Finnish study. Okay, so the results of this study show that prior exposure to systemic antibiotics was associated with increased risk of the incidence of type 2 diabetes in more than 25,000 participants. So this is a pretty big study. This isn't a small-scale study. Furthermore, prior exposure to antibiotics was also associated with being overweight and obesity. Now, if you come down here, 4 previous studies, so this research study also cited 4 other studies. 4 previous studies have examined the relationship between antibiotic exposure and the subsequent incidence of type 2 diabetes. These reference footnotes are here, so those of you that actually want to go back and look these things up, you know, you can check that study out. You can click on these and go read these other studies. But basically, there have been some major research studies that have found that antibiotics, the more you use them, the greater the risk of the development of diabetes and obesity. Now, in this particular study, you see here the beneficial role of vitamin K supplementation on insulin sensitivity, glucose metabolism, and the reduced risk of type 2 diabetes. This is a review study, a review paper. But what I want to point out here, the reason I'm bringing this up now is because when we use antibiotics, 60% of your vitamin K1 is produced by your microbiome. So your daily need for vitamin K1 can come from food. You can get vitamin K1 from dark green leafy vegetables, are a great source of vitamin K1. But 60%, meaning more than what your diet gives you, comes from your microbiome directly. And when we have a chronic use of antibiotic happening, what are you doing? You're neutralizing your microbiome as an agent to help you with your own nutrition. And so what do we know about vitamin K? Look here. Moreover, several human studies reported the beneficial role of vitamin K supplementation on improving insulin sensitivity and glucose tolerance, preventing insulin resistance and reducing the risk of type 2 diabetes. Both animal and human studies have suggested that vitamin K-dependent protein osteocalcin, regulation of adipokine levels, anti-inflammatory properties, and lipid-lowering effects may mediate the beneficial function of vitamin K in insulin sensitivity and glucose tolerance. So, vitamin K is kind of it's one of the vitamins that gets very little attention. Most of the attention with vitamin K has come along here recently with vitamin K2, but we're talking specifically about vitamin K1, which most people equate vitamin K1 to the blood clotting cascade, but it's very important for helping your body regulate blood glucose. Now, this is a study on the left-hand side. You can see comparative effects of vitamin and mineral supplements in the management of type 2 diabetes in primary care, a systematic review and network meta-analysis of randomized controlled trials. So this was the conglomeration of 170 studies with 14,223 participants, and this is kind of the overview. This is an infographic, if you will, of the overview of this meta-analysis. And here's what they found about specific micronutrients. They found that chromium supplements ranked best in reducing fasting blood glucose levels. And HOMA-IR. HOMA-IR is basically, it's a calculation that doctors do. A lot of lab tests now are reporting a line item on your lab called HOMA-IR, which is just a calculation multiplying your glucose and your insulin. And so anyway, HOMA-IR is not an actual measurement per se. It's a calculation based on your glucose and your insulin. But nonetheless, chromium supplementation was ranked best at reducing fasting blood glucose. We also see vitamin K was most effective in this meta-analysis of reducing hemoglobin A1C, which is the long-term marker for looking at blood sugar. So vitamin K reduced hemoglobin A1C and reduced insulin. And then we have vanadium. Vanadium supplementation ranked best at lowering total cholesterol, although vanadium plays a major role. When you look at it here, plays a major role in improving insulin sensitivity and insulin receptor function. So that's this diagram here. You can see interrelations between essential metal ions and human disease. In this case, vanadium can block PTP and thus restore the signaling pathway. That's this mechanism right here. This is your insulin receptor. This is vanadium. It blocks this substance here. And so it improves the functionality of the insulin receptor. The insulin receptor then sends a message to this doorway in the cell. It's called a GLUT4 door, which is what allows glucose to come into the cell and be converted into its substrates to make energy. So vanadium, very important, although in this meta-analysis, they're talking about vanadium and its role in reducing cholesterol, but also understand it also plays a role in improving insulin receptor functionality. And then we have niacin, which is vitamin B3, most effective at lowering triglycerides, which we talked about a minute ago, but also improving or increasing HDL, which is what doctors like to call the good cholesterol, if you will. And then we have vitamin E, which has been shown to reduce LDL, what doctors like to call bad cholesterol. Now, how many of you have ever gone to your doctor and they said, let's give you some vitamin E to effectively help you with your cholesterol? Raise your hand and let me know if that's ever happened. I always find it interesting. Nobody ever raises their hand because most doctors don't know anything about nutrition, and so they would never even begin to recommend these types of things, even though, as you can see here, this is a major research meta-analysis showing that these things are effective. At any rate, this is a summary. You've got here some additional data on vitamin K1. You can see the study for the first time demonstrated that circulating vitamin K1 was significantly lower in type 2 diabetes patients compared to age-matched control subjects, and that vitamin K1 levels in type 2 diabetes were significantly and inversely associated with fasting glucose and insulin resistance, as well as the HOMA-IR, which is the homeostatic model assessment of insulin resistance, which suggests that boosting plasma vitamin K1 may reduce the fasting glucose and insulin resistance in type 2 diabetes patients. So again, vitamin K, and that, based on this summary, its effect greater than anything else on hemoglobin A1C and insulin regulation.